Hello, beloveds, and welcome to Christian Emotional Recovery, a podcast for those who are survivors of childhood trauma, emotional neglect, and narcissistic abuse. This podcast is hosted by Rachel Leroy, a college professor and trauma survivor. Many of us spend years trying to heal and don't get anywhere. We don't always target the trauma itself, which is so often what keeps us stuck. This podcast is where faith meets science. Rachel is an emotional healing expert with 20 years of experience applying healing modalities that helped her start making progress after nothing else worked. She'll show you how to do the same. Each week, we'll cover a topic that will show you how to heal trauma for good. Please check out our website and show notes at ChristianEmotionalRecovery.com and join the Facebook community, Trauma Survivors Unite, Christian Emotional Recovery.
Hello, everybody, and welcome to Season 2, Episode 16 of Christian Emotional Recovery. I'm your host, Rachel Leroy, and in our last episode, we did the first part in a two-part series, and that part was called Somatic Practices for Healing Trauma, Part 1, Practices You Can Do on Your Own, and that was Episode 15. Today, we're going to continue this series and finish it up. It's a two-part series, and this one is Somatic Practices for Healing Trauma, Part 2, Therapies You Can Do with a Professional. Therapies You Can Do with a Professional. So it's Part 2 of Somatic Practices for Healing Trauma. And I want to make a big disclaimer on this one. I'm putting a lot of ideas out there that are controversial in this episode and things that are not safe for everybody to use. So I'm not recommending these strategies and methods for everybody in every circumstance. I'm not a medical professional. Please seek the help of a therapist, a doctor, and or a psychiatrist before using these therapies, especially the ones that I'm going to put a disclaimer on, because a lot of these are not right for everybody in every situation. And so I will put specific disclaimers on some of them. And also, as Christians, I know that some of these might be controversial as well. So, show me some grace. I'm just putting it out there because trauma is a very serious condition and it affects your everyday life. And all I want to do is help you to see light at the end of the tunnel and to find healing. So if you feel like one of these practices is not something that meshes with your convictions and with what you feel like God has taught to you, then that's fine. And just give other people the freedom to do the same thing, because a lot of these are not clear-cut therapies, and so you need to allow people to make their own choices and use their own discernment with God's grace as we go through this process of trauma. Trauma is very painful, so we need to give each other a little grace in these circumstances with what we use. I'm not promoting any kind of sin. I'm not saying you should do anything really bad, but I'm just saying that some of these therapies are a little out there, they're a little experimental, and some of them do involve certain kinds of chemical substances that should only be used under a doctor's guidance. Key phrase there. So I'm not condoning you go and use any of these substances on your own. Absolutely not. And I'm actually telling you, do not do that, please. Okay, so I'm putting that disclaimer out there now. You probably don't even know what I'm talking about, but once I get into the podcast episode, you'll understand. Okay, so bear with me, follow me, keep an open mind, but also note that in certain circumstances, there are going to be therapies that flat out are not for you, and I will say so. So please don't think that I'm telling you what to do, but I'm just putting that disclaimer out there to protect you, protect me, and make sure that you're clear on where I stand on this stuff, okay? Does that make sense? So let's go ahead and jump right in. First, keep in mind that Christian Emotional Recovery is the podcast. If you haven't, please subscribe to the podcast on your favorite platform, whether it's Google Podcasts or Apple Podcasts or whatever platform you like. You can also go to ChristianEmotionalRecovery.com for more of the same. And also check out the YouTube channel, ChristianEmotionalRecovery.com. And I will put a link to that, all of those, in the show notes. And click on the subscribe bell because you can get things in the YouTube channel you can't get anywhere else. Also, something new, I just opened an itty bitty little store and I'm going to be expanding it, but check it out. I will put it in the show notes and I'll put it in big letters so you can see where it's at, and check out the store. It just has the meditations right now, but I will be adding more products there that you can buy, and I will put that money back into the podcast to help me pay for expenses and honestly, to help me make a living, because I do put anywhere from 10 to 15 hours into this podcast, and with health issues, that's quite a chunk of time on the side of my adjunct teaching. So I do need the support, and I do appreciate it. Thank you so much. And so just check out those links in the show notes. And lastly, if you haven't joined, check out the Facebook group, Christian Emotional Recovery, and I will also put that in the show notes. So check that out below. So let's go ahead and talk about the therapies that I'm going to include here. Now, somatic has a very broad connotation or meaning, and somatic just means physical. And as you know, if you've experienced trauma, childhood trauma, PTSD, CPTSD, which is complex trauma, you know that it's a very physical experience. Your breath gets short, your heart beats fast, you might get flushed, you might start shaking, you might start crying. There's a lot of physical manifestations of how trauma, fight or flight, and being in that state all the time manifests itself. And of course, as you know, it also can cause chronic conditions, because that puts a strain on your body's systems, because they're not meant to be in that state all the time. And that's not your fault. If you have chronic trauma or regular trauma, it doesn't matter. If something happened that was outside of your control, that is not your fault. If now, when something similar happens or certain triggers happen, you have that response or that reaction. That is absolutely not your fault. But a lot of the new technology and a lot of the breakthroughs that we're seeing is showing that trauma can be at least partly healed and managed, and in some cases, maybe cured. So do not give up. Keep trying to find ways to get yourself to feeling better. So this complements the first episode where we talked about practices you can do on your own by talking about practices you can do with a professional. So some of this is very physically based, and not all of it is like mental health therapy per se, but in Chinese medicine, they have believed for thousands of years that the body and the mind are not two different things, they're the same thing. And there's actually science coming out, many studies that back this theory. They're overlapped so much that you really can't separate them. And what happens in your body affects your mind, and what happens in your mind affects your body. I mean, it's just common sense too, because your brain is part of your body. Your neural network is part of your body. And so how can you separate those two things? Your mind is in your body, and your body, what happens to it affects your mind. So that's why I'm doing really physically based therapies for this one. And the reason that I'm emphasizing that they are with a specialist, a licensed specialist in this field, in many cases, a medical doctor, a psychologist, or a psychiatrist. You need to only go to qualified people who have good ratings and respect in their field if you do any of these practices. Protect yourself, do your research, do your homework if you go and look for any of these therapies. So really, the first one is the only one that's not just physical, but keep in mind that what you do with your body, a lot of body therapies, because your trauma gets stuck in the body, a lot of these therapies can actually heal trauma at the level of the body, and it helps you to contact those places in your mind too where the healing can reside. For example, there's a therapy called Cranial Sacral work, where the therapist, the specialist, works on your cranial system, and they work with the energy in your body. This is not new age woo-woo stuff, but it's actual trauma that's stuck in your body. And that there are people that when they have a session like that, they'll just start crying and they don't know why. And I don't know if you've ever done like deep stretches or something like that. yoga, you don't have to have done yoga, but like if you've done deep stretches, what I find is when I do hip stretches, I feel very emotional and I actually feel a release of emotions in my body. And if you feel tight and it's because of a lot of stress, and then you do a deep stretching routine, you literally don't just feel the relief in your body, you feel it in your mind. And so there's a deep connection where a lot of these therapies will help you to feel better physically, not just mentally. And so the ones that I wanted to go through today are co-regulation with a therapist, chiropractic treatment, and I wanted to specifically talk about Atlas orthogonal chiropractic treatment. You're probably wondering what the heck that is. We'll talk about it in just a little bit. The next one is cranial somatic or cranial sacral work, cranial somatic and cranial sacral work, massage, acupuncture, and then some of these are the chemical ones I was talking about, and so that's where I put that disclaimer up. Ketamine, microdosing of psychedelics. Yes, you heard me right, microdosing of psychedelics. You might be like, what? This woman's condoning some really crazy stuff. Just follow me here. I just want to tell you what it's about. I'm not telling you to do it, and I'm definitely telling you not to do it on your own. Do not do it on your own, okay? And even then, that doesn't mean you should do it. I'm just putting it out there. The next one is more like stimulation you would do to your nerves, and one of them is TMS, and it's transcranial magnetic stimulation. It's not electric shock therapy, but it's a gentler approach that's very similar. That's TMS, transcranial magnetic stimulation, and the last one we're going to go over is called VNS, or vagus nerve stimulation, VNS or vagus nerve stimulation. So let's go ahead and jump into the first one, co-regulation with a therapist. And this is the only one, like I said, that is not physically based, but I wanted to call it a somatic therapy because co-regulation is in the body and it has a lot to do with the body. So let's look at it and talk about it. So the key when I'm sharing all of these is you need to go do your own research. You need to talk to a professional about these. I have to put this back on you. I can't make recommendations of specific specialists, but I'm just telling you these treatments, and then you need to find somebody who's trauma-informed, compassionate, licensed, experienced, and has good ratings and reviews from previous clients and customers and patients. Okay, so those are some things to look for when you look at any therapist, practitioner, doctor, or specialist in any of these areas. And make sure that they have the right licensing to be doing what they're doing, because in all of these fields, there is a specific licensing you have to have. And just make sure you're not going to a quack, because there are a lot of quacks out there, as you know. So let's go ahead and look at co-regulation with a therapist. Please bear with me as I go through these because I'm using a lot of dense source material. I've got several articles for this podcast because it's so information-based, and bear with me because it's information-based. I think that, though, if you haven't done extremely thorough research on trauma recovery strategies, you'll probably find something in this podcast episode that might help you that you might want to research. So let's look at co-regulation with a therapist. It's from a website called the Center for Resilience Informed Therapy. The Center for Resilience Informed Therapy, and this article is written by Dr. Ariel Schwartz, and she's one of the leading experts in trauma recovery, and it's called Connection and Co-Regulation in Psychotherapy. So it talks about how to use co-regulation as a tool for healing with a therapist. You develop a professional and safe bond with a therapist that you trust. That's part of it. You have to trust the person. So keep that in mind. And then, I wanted to read a little section from this section here called Discovering Self in Relationship. And so that'll help you to understand a little bit about what co-regulation is, how it can help you heal trauma therapy, why it's somatic, and why you can co-regulate with other trusted people. Okay, so this isn't one where you only do it with a professional. You can co-regulate with your cat or your dog or your fish. Well, it's kind of hard to cuddle a fish, but you get what I'm saying. And you can co-regulate with your spouse or your best friend or your family members that you trust, or somebody at work that you trust. But here's what co-regulation is. It says connection at its core is the core of all human experience. We all share the need to be seen and understood. We long to belong and to experience ourselves within the context of loving, nurturing relationships. Sadly, childhood neglect or abuse betrays our trust in others and can impair our ability to form healthy relationships as adults. A history of trauma also can contribute to ongoing experiences of dysregulation of the ANS, or the autonomic nervous system. And that's where you're in fight or flight a lot of the time. And it says the ANS is part of the nervous system that manages how you respond to stress and allows you to relax in response to your environmental cues. Ongoing emotional dysregulation tends to interfere with our capacity for intimacy, parenting, and meaningful friendships. The concept of co-regulation is also called mutual regulation or social affect regulation. And it can be defined as the way in which one person's autonomic nervous system sensitively interacts with another person's autonomic nervous system in a way that facilitates greater emotional balance and physical health. And I would argue when it's co-regulation, it's with two people. So it's a close, safe connection between two people, but you feel it in your body. It's a sense of safety and trust. That's my word. Back to Dr. Schwartz. Simply put, we humans are deeply interconnected with others and influence each other in a multitude of ways. Now back to my ideas. This is why I say, even though codependency is unhealthy and you shouldn't be exclusively dependent on other people, and that it can go to the point that it's unhealthy and you get enmeshed with people and your sense of well-being and worth is completely rooted in other people and you become a people pleaser, that's the other extreme of that that's not healthy. And then if you're a people pleaser, you put that above being true to yourself and obeying God, which you should put first. And then, because I argue that those two things go together. If you obey God, you're being true to yourself. So you have to put that first. And then co-regulation is not the same thing. Co-regulation is when you have a healthy connection with a safe and healthy other person. And it does make you feel better, but you're not like completely enmeshed in that where if you don't have that right at that moment, you're not okay. Does that make sense? So it helps you and it's healthy. And then there's a quote here by Dr. Schwartz where she says, through a healthy therapeutic relationship with a therapist, you have opportunities to attend to the relational wounds from your childhood. Co-regulation in psychotherapy provides opportunities for you to have new, socially learned experiences of connection, attunement, acceptance, and compassion. Through somatic psychology, we can fine-tune this exchange to find the sweet spot where our deepest healing resides. Dr. Schwartz. So let me give you an example from my experience. You can become enmeshed with a therapist in a way that's unhealthy. And I've seen that. I know a therapist who would let people call her house and would have them stay at her house and stuff like that. And she meant well, but that's not healthy. There needs to be a professional boundary between a therapist and their patient. Even if there's a deep connection, even if there's care and all of that. For example, I still call my therapist Dr. So-and-so. I call him by his name, his last name. So there's a professional boundary there, but that does not mean there cannot be a genuine connection that allows you to co-regulate. And that co-regulation with that therapist helps you to develop trust, helps you to regulate, helps you to learn to trust another individual so that you can carry that into other relationships. And so co-regulation is healthy if it's done in the right context, okay? So, of course, I want to read another part of the article where it talks about co-regulation in somatic psychology. So you can see how this is a somatic thing as well. And it says in co-regulation in somatic psychology, same article by Ariel Schwartz, it says within somatic psychology, we accomplish co-regulation through the development of body awareness. Within this process, both therapist and client develop a capacity to notice moment-by-moment changes in sensory experience. Both begin to pay attention to subtle changes in tension, temperature, or level of energy that provide information about how to pace the processing of a traumatic event. For example, you might notice while talking about your experience, you suddenly become distracted or fatigued. Or you might notice a pressure building in your chest. Therapist's own embodied awareness also provides valuable insight. Perhaps the therapist notices somatic sensations that might parallel those held by the client. That might be empathy. Rather than overriding these signals, both therapist and client learn to slow down the process and pay attention. And this is my note, but if you have a modeled behavior from a good role model of how to co-regulate in a healthy way, then you can start to do that for yourself as well. And that's what my therapist has been able to do with me through using a system called internal family systems. But Ariel Schwartz says the therapist offers their attention and safe, calm presence as a resource to the client. So you get validation. And that's one way you get healing. And it says, as the therapist takes a deep breath, the client is invited to do the same. Together they find their way from defensive activation into warmth of a nurturing connection. So that's how co-regulation works with a therapist. And since we have several to go through, I wanted to go ahead and move on to the next one. But that one, you can co-regulate with anybody who's safe. Just make sure they're safe. And then it doesn't have to necessarily even be, I need you to help me co-regulate my trauma. It could just be that you're not feeling safe and you talk to somebody you trust. Or you're feeling a little anxious and you go hug your cat or your dog and maybe nobody's there, so you talk to them. Some people think that's crazy. I don't think it's crazy at all. I talk to my cat like she's a person, and sometimes when I have a problem, I'll talk to her about my problem. She's there. I mean, she's another body. She's a safe body, so I utilize that resource. So just keep that in mind. And of course, it needs to be someone who's consenting to it, of course, and you don't want to abuse that. But you see what I'm saying? You can find a safe person to co-regulate with by talking to them, by asking for a hug. There's a lot of ways you can do that. So the next one is chiropractic or Atlas orthogonal therapy. And Atlas orthogonal therapy is just a type of chiropractic therapy. Now, maybe chiropractic isn't for you. That's fine. Only see a licensed chiropractor to get these techniques. Don't be doing this on your own. Don't be having other people do it for you. I'll admit, I'm guilty. I've had people walk on my back. I've had people pick me up and crack my back. But you can get hurt that way. It really isn't a wise idea. So even though I know people do it, I just want to put that out there to just be careful, okay? So let's look at a little bit about this. Now, in chiropractic therapy, Atlas orthogonal is still a bit cutting edge. It is based on research. There is a school where you have to get licensed for that particular therapy of chiropractic. So you get a doctorate in chiropractic practice, and you have that. But if you practice Atlas orthogonal, you have to have another training for that because it's a specialization. Okay, so you may be asking, what is that? So I just wanted to tell you a little bit about Atlas orthogonal. So for me, I haven't talked a lot about the medical issues I've been going through, but I'll just tell you a little bit about them so you can understand why Atlas orthogonal has been so helpful for me. Atlas is ATLAS, and Atlas is the top bone in your spine. It's at the top of your cervical spine, which is your neck, and it's the base of your skull. So it's the pivot bone that holds your skull and where your skull moves around on it, okay? And orthogonal, I honestly don't even know what that means, but it's Atlas orthogonal is a type of chiropractic. I'm going to assume you know what chiropractic is, but it's a type of chiropractor practice that focuses on balancing that bone, and it pivots down to the rest of your body. So if you get Atlas orthogonal treatments, you have to find a specialist who does it. Not all chiropractors do it. As a matter of fact, most of them don't. But there are a few that do. I found a really wonderful one. She's a Christian. And I said I wasn't going to recommend them, but if you're anywhere in the Savannah, Georgia area, Dr. Whitney Denton, she's wonderful and very professional, very kind. And but that's the one that I'm seeing. And I started having nerve pain that could have been a condition that was very debilitating and painful, and I couldn't figure out what it was. And that condition only gets worse, and then it goes from worse to horrible. That's the only stories I heard about it. So of course I panicked, and I've had issues with the spine, subluxations. I've had all these x-rays. I've done physical therapy. Long story short, with this nerve pain, I would feel it in my ears and my throat and my face. and it was a type of neuralgia potentially. So I was getting treated and knocking other things off the list that have similar symptoms, and I started doing some research, and I saw some people that had gotten a lot of relief this way. So I went and saw this person, and I saw her, she assessed me, and I saw her once a week. So I would drive an hour once a week just to see her because that was the closest one, and she's the only one within an hour and a half. And then I would see her once a week for about 12 weeks, and then she's put me on every 2 weeks, and then she'll put me on about once a month or every 3 weeks, and it spaces out until you only come back until you need treatments. But the reason that it's good for healing trauma is because the spine and the neural network and all of that, it's all interconnected. Like I said, in Chinese medicine, it's called the body-mind, not just the body or the mind. And so chiropractic is a way to treat your whole self. And so when you start getting your body aligned, a lot of times when you have trauma, you've got all this tension in your body, and people think that if you just take some deep breaths, do some stretches, all the tension goes away. What I'm finding is with my physical therapy, with my chiropractic treatments, I feel more human than I ever have. And there's tension in your body that goes so deep that it takes repetition. It takes time for your muscle memory to understand what's going on, and for the release of that tension and your spine being straight to become the norm again. So your body could be all bent over and contracted and tense, and it takes months of therapy to get your muscles to align with that, because you have to train your muscles just like you would if you were doing a fitness program. So your muscles get all twisted and contracted, and it's just all connected, and it connects to your nervous system, which can cause other physical problems. And so you may find that if you release that stuff and you decompress your spine and you align your skull and your bones and your muscles and your neural network, that will bring a lot of relief to all those systems in your body. So I couldn't find an article that wasn't on an Atlas site of a specialist. So, I didn't want it to be from something that was biased. So I just talk about, I found some articles that were about how chiropractic treatment can help you in terms of PTSD in general, and Atlas Orthogonal, being a sub-branch of that, automatically would go into this category. So I would argue that it would actually be helpful. So there's an article here called Improvement in Depression Following Reduction of Upper Cervical Vertebral Subluxation Using Osteospinology Technique. Whew, that's a mouthful. Basically what it means is if you align your upper vertebrae, the cervical vertebrae is your neck spine, that if you can get those subluxations, which are the misalignment in your spine, if you can straighten those out and decompress that, it brings you a lot of improvement in depression and mood. So that's great news. And I found that after a chiropractic treatment, sometimes you'll actually feel worse because you're releasing toxins from your body. And I would argue, this is probably going to sound a little woo-woo, but sometimes I've gotten emotional, and I think some of that trauma actually gets stuck in your bones and your muscles, and some of it is stuck there. And then when you straighten that out, it actually releases some of that tension and that trauma from your body. So sometimes, if you've ever done a detox or something, it actually pushes that stuff out of your body, and you'll feel worse because it's coming up and out. Kind of like when you process trauma, it's the same thing. It's coming out of your body, so you're going to feel kind of crappy for a few hours or a day or two, and then you'll feel much, much better than you did if you'd never done it. So this article, basically, it talks about, it says, it is, and this is by Glendon Gintner, Harris Friedman, and Charles Studley. Okay, those are the authors. And I will include this article, but I'm not going to read a lot of it because it's a scientific article, and I try to stick to more layman's articles. So I'll let you read this if you want, but I'll put it in the show notes. All of the sources I'm using, as always, are in the show notes, and I credit the authors. So it says, it has been long speculated that chiropractic interventions may affect mental health problems. One such intervention, as osteospinology technique to correct I don't know. I'm not going to read all that. But it basically corrects the spine using a procedure, I'm not going to read all that, has been anecdotally noted to improve depressive symptoms. So there's not a scientific study behind this, but this is a paper written by experts in the field, and they're telling a pattern of what they've noticed, and there's something to that. Consequently, 15 adults were selected by by being treated chiropractically as both clinically depressed and having an upper cervical subluxation, misalignment. Then treated with the intervention of 3 private practices setting in the southern United States. But they were given that therapy, and it basically says that they demonstrated significant improvement in their depression test scores. In the conclusion, the data supports the hypothesis that the chiropractic technique to correct that area of the spine using that technique may relate to reduced depressive symptoms. Note that I partly quoted them and skipped over some of the big, long, boring words, but you get the idea. And there's another article here that talks about, it's by the Mayo Clinic. I've actually been to the Mayo Clinic. I went there a few weeks ago to try to figure out what was going on with my nervous system and all the symptoms I've had. But it says chiropractic adjustment is a procedure which trained specialists, chiropractors, use their hands or a small instrument to apply a controlled sudden force to a spinal joint. The goal of this procedure, also known as spinal manipulation, is to improve spinal motion and improve the body's physical function. And then it talks about the risks. You need to be aware of the risks of any procedure you do, and a doctor or a specialist that you're working with should always be upfront about that and should never promise you miracles. They can promise you great relief, but miracles, no, I would not believe that. But the Atlas Orthogonal, they use this thing that's like a, I don't know what it is. It's like a pin or a needle. It doesn't have a pointy end, but it just like, they take x-rays, 3D x-rays of you in every direction, and then they see where your skull is misaligned to your spine, and then they have this machine, this thing that they put you on where they can see at what angle they need to adjust you. So they do it based on not guesswork, but precise numbers. And then they have this thing that you lay down and you put your head in a certain direction, and it just pokes you just a little bit. You don't even feel it. It's not painful. It's not scary. And you're like, are you going to do it yet? They're like, we're already done. You're like, what? And it's what it does is it realigns your atlas, that top bone, and everything else follows because it leads. Does that make sense? So it's like a snake's head that leads the body in a certain direction. It aligns it that way. And then you ever seen those ball things on the top of somebody's desk where you hit the end and there's all the ones in the middle and only the other one on the end? That's how it works. It does just a little bit of impact and it realigns your spine. It's amazing. It doesn't hurt, but you still need to be careful, and you still need to know the risks, and you still need to be informed before you go into this. So a little bit more about chiropractic treatment in general, and keep in mind, if Atlas Orthogonal is not for you, I've done regular chiropractic treatment. I have a doctor here where I live, and he's wonderful. He's also a wonderful Christian man. Not all the people I see are Christians, but that's a good thing when you can find somebody who's very professional and knowledgeable and they're a Christian. But it says, this article says, chiropractic adjustment can be effective in treating low back pain, although much research shows only a modest benefit, similar to the results of more conventional treatments. Some studies suggest spinal manipulation may be also effective for headaches and other spine-related conditions, such as neck pain. Not everyone responds to chiropractic adjustments. A lot depends on your particular situation. If your symptoms don't begin to improve in several weeks, chiropractic adjustments might not be the best option for you. So I just put that little disclaimer out there. From the second article is Chiropractic Adjustment by the Mayo Clinic. Okay, so that's the source. I'll put it in the show notes as well. That's the second therapy. Now, the third therapy is one that's a little more unconventional, a little less known, but there are still people who are licensed in this area, and I have gotten some treatments with cranial somatic and cranial sacral work. There is a slight difference between cranial somatic therapy and cranial sacral therapy. I think one focuses more on the spine and skull itself, and the other one focuses more on the entire cranial system. And I couldn't find a lot on cranial somatic therapy. So if you find cranial sacral That's also very similar, but it's not exactly the same thing. But when I had that work done, I felt so much tension and stress and trauma leave my body that I felt emotional. So it was amazing what it could do. And you're probably wondering, well, what is cranial sacral therapy? So let's look at it. Let's talk about it. And then a Healthline article. It's in Healthline, and it's by Anna Gotter, Gotter, and this is from Healthline, and it says cranial sacral therapy, also known as CST, is sometimes also referred to as cranial sacral therapy. Okay, one is 2 words and the other's 1 word. It's a type of body work that relieves compression in the bones of the head, sacrum, which is a triangular bone in the lower back, and spinal column. CST is non-invasive, and it uses gentle pressure on the head, neck, and back to relieve the stress and pain caused by compression. It can, as a result, help treat a number of conditions. It's thought to have, through gentle manipulation of the bones in the skull, spine, and pelvis, and flow of cerebral spinal fluid into the central nervous system can be normalized. This removes, quote, blockages from the normal flow, which enhances the body's ability to heal. And there are licensed professionals in several fields that can perform it, like massage therapists, physical therapists, osteopaths, and chiropractors, but they have to have a license to practice this specifically, and there are people who do this exclusively. And it says it can be part of an already scheduled treatment visit or the sole purpose for your appointment. And it says, depending on what you're using CST to treat, you may benefit between 3 and 10 sessions, or you may benefit from maintenance sessions. And so it gives you a list of all the things that it can help you with. And some of those are migraines, headaches, constipation, irritable bowel syndrome, disturbed sleep, scoliosis, sinus infections, neck pain, fibromyalgia, recurrent ear infections and colic in infants, TMJ, which is the jaw thing, trauma recovery, including trauma from whiplash, that's physical trauma, mood disorders like anxiety and depression, which a large portion of the time arguably come from trauma, and difficult pregnancies. So it treats and helps a lot of different things. And keep in mind that a lot of these are chronic conditions that are either triggered by, caused by, or exacerbated, made worse by PTSD and being in fight or flight and stressed so much of the time. So cranial sacral therapy, you do have to avoid it if you have an aneurysm, a bleeding disorder, or a history of recent traumatic head injuries. And it tells you a little bit about how you do it and the takeaway from it. And it's not going to relieve everybody. It's not for everybody. You need to find somebody that's licensed and experienced and knows what they're doing, somebody that can have some empathy for your trauma. But just keep in mind that that is another therapy that a lot of people have done. I've done a little bit of it, and it has been wonderful. So just keep in mind that cranial sacral or somatic therapy is another possibility. The next therapy is massage. Now, some of you have probably done this one. You probably just do it to relax yourself, to treat yourself, to feel good, to unwind. Maybe you've had your spouse or your partner or a family member give you a massage, or you've given them one. Maybe you've had a professional do it. I'm not saying you can't have somebody give you a massage if they're not licensed, but just be careful because you can get hurt if it's done in the wrong way. And if you get a full massage, get it from a professional who is licensed. That's all I'm saying. So this isn't one that I'm too worried about too much, but I just put it out there again. And I'm using an article from this one called Mind, Body, Spirit Interventions for Patients with PTSD. And it's by Leslie Korn, PhD, MPH. And it's on the Psychiatric Times website. So I just wanted to read a little bit here to tell you a little bit about how body work and massage can help you with trauma and help you heal stress and help you heal the triggers of stress and help to get some of that trauma. It automatically releases from the body with some of these techniques. So basically the point of this article is to use different types of techniques that are non-chemical to help you to relieve symptoms of PTSD. It says these methods facilitate deep rest, help reset circadian rhythms, and release endogenous opioids and cannabinoids that help reduce anxiety and enhance a sense of natural well-being for people with PTSD. So the opioids and cannabinoids they're talking about are the natural ones our bodies make. It's not you taking some kind of drug. I'm not condemning somebody that has to take those under the very careful help of a medical professional. Okay, I actually take CBD gummies and they are amazing. Again, I would talk to my doctor before I do that. I'm not saying they're for everybody. I take the ones without THC. Again, whether you do that or take it with the THC, that's entirely up to you. That's between you and God and your doctor. Okay? It's nobody else's business. But you need to make sure that you're careful if you have proneness to weaknesses with addiction. If you already have an addiction and you're in recovery, you know this. But I have to put that out there. You know that. So I just wanted to read a little bit from this article and tell you a little bit more about how massage can actually help you with healing PTSD and some of these more mind, body, spirit type, also MBS is what it's called, type therapies. So PTSD is quintessential mind, body, spirit disorder that alters physiological, biological, and psychological homeostasis, which is balance. People with PTSD and complex trauma often experience dysregulation of multiple systems that impairs physical, affective, and cognitive function, which can lead to a profound sense of disconnection from others and loss of purpose and hope. And sometimes it says that they have disassociation, and it talks about all these different problems that can happen with the body and with your behavior, eating disorder, substance abuse, self-harming behaviors, chronic illness, autoimmune disease, and then it names some, and you get the idea. But it says MBS methods provide integrated approaches to psychophysiological, so the mind and the body, self-regulation, and promote self-care behaviors. These methods facilitate deep rest, like massage, help to reset the circadian rhythm, and release endogenous opioids and cannabinoids that lead to a reduction of anxiety and enhanced sense of well-being. Some may also offer a strategy, meditation, chanting, aerobic exercise, hot yoga, again, use your discretion, to gain awareness over and control over the dissociative process of PTSD. Relaxation techniques like breathing, guided imagery, progressive muscle relaxation, and energy psychology, tapping, tai chi, qigong, are practical and beneficial methods that are easily incorporated into daily routines. Again, I'm just reading the article. I'm not saying you should use any of those methods, but a lot of these mind-body practices are very helpful, and there's a lot of research that suggests that. So I wanted to look at the section on body work, massage, and somatic therapies, which is what this entire podcast episode is about. And the Psychiatric Times article says, considering the experience of somatic distress in PTSD, it's understandable why many people explore alternative interventions. And I can tell you from experience, I went through the medical doctors and they couldn't find an answer to what was going on in my body. I still don't have a diagnosis, but I treated some of the symptoms through these therapies, and I got more help that way than I did with my doctors. My doctors helped me, and I still recommend going to them, but I'm just saying that this is another alternative. And it says some bodywork therapies emphasize deep relaxation, while others incorporated guided imagery and psychotherapeutic exchange during massage or somatic awareness exercises. Massage techniques range from a very light touch to a deep touch. You've got Swedish massage, which is light touch, and you've got deep tissue massage, which is deeper, and you've got combination massages and so on. You've got you've got those stone massages, and you've got all kinds of massages. You've got reflexology, which is your feet. There's a lot of belief that the feet connect to the rest of the body. I don't know if that's true, but it's called reflexology, and that's another type of massage. But it says some only use pressure points. Others use oil, rocks, stretching, petrissage, I don't know what that is. Cross fiber friction with the patient either clothed or unclothed and draped. At least moderate pressure is required to stimulate vagal activity and induce parasympathetic response. Now, if you've listened to some of my other podcasts, and the YouTube channel talks about this especially, but the vagal nerve is what regulates your emotions and your mood a lot. And the parasympathetic response is that one that regulates you and calms you down. So that's what massage actually does. It helps you with regulation. And that's how it can heal PTSD. Massage controls pain severity through its effects on both physical and psychological symptoms. A significant reduction of PTSD symptoms has been seen, for example, in veterans after massage therapy. I'm assuming veterans with PTSD. It doesn't matter, though, where your PTSD came from. If you have PTSD, these therapies will help you. Moreover, findings suggest a reduction in substance abuse, anxiety, stress, depression, and disassociation. A community-based study with trauma survivors found significant improvement in the domains of interpersonal safety, interpersonal boundary setting, bodily sensations, and bodily shame in response to massage and energy-based therapies. So basically, it's saying massage therapy can help you with PTSD symptoms and other side effects of that kind of condition, like depression, anxiety, eating disorders, and so on. Okay? So that is why massage is helpful. And you can just know from experience that it makes you feel good. It makes you feel better in a very deep and healthy way. Usually when you have a massage, when you're done, you're just like, you feel so much better. And I'm aware that not everybody can afford all these therapies. And, I'm just putting this stuff out there so you are aware of it. The next one is acupuncture. Now, all the treatments up to now, I've done myself. I've never done acupuncture. It's just something I've never done. I don't have an opinion about it one way or the other, but I wanted to put it out there. And I wanted to read a little section about acupuncture from the same article I was just reading. And it's a section called Acupuncture, appropriately. This is from the Psychiatric Times, and it's Mind, Body, Spirit Interventions for Patients with PTSD, and this is by Leslie Korn, PhD, MPH. So let me read the section on acupuncture so you can know how it can help you potentially with PTSD. Again, do research. I'm not saying this is for everybody. And like I said, use discernment and pray about it and talk to a professional. Traditional Chinese needle insertion along meridians, electro-acupuncture, and auricular acupuncture are widely used for treatment of PTSD symptoms. And I did want to put a note here that there's been a lot of emerging research that acupuncture works. And it doesn't work for everybody in every situation, but it does bring people relief from physical pain, physical health issues, and emotional issues, and things like PTSD, depression, anxiety, and so on. But it says systematic review of acupuncture for PTSD shows results ranging from positive to mixed. Both body and auricular acupuncture reduce the severity of withdrawal symptoms associated with rapid opiate detoxification, increase participation in rates of patients in long-term treatment programs, and reduce cravings and relapse. So acupuncture can actually help people who are in addiction recovery. And then it says, of particular interest for PTSD are 5-element acupuncture, a method that actively incorporates a spiritual and emotional approach, and Japanese-style acupuncture that uses very light needle insertion, which is ideal for young children, the elderly, needle-sensitive individuals. It says the National Acupuncture Detoxification Association protocol is also widely used. I won't go into all that, but you get the idea. And it applies to a large number of individuals concurrently in community-based settings and in war zones and refugee camps and during disasters. And even like doing some tapping on your own meridian points, tapping or EFT, emotional freedom technique, can be helpful. And when it's under medical supervision, it can be a great adjunct or supplemental practice to other practices that you do in conjunction with traditional medicine, like seeing a psychotherapist or seeing a doctor. So basically, acupuncture can help some people with releasing some of that trauma from their bodies and to help heal and bring your body back into balance. I don't fully understand it because I've never done it, but I've had friends that have done it and they've said that it worked really good for them. So it probably depends on the person, but I wanted to put it out there. All right, so the next therapy is the one where I do need to put a strong disclaimer. If you have struggled with chemical addictions of any kind, whether it's prescription drugs, alcohol, or other types of drugs, street drugs, I would probably recommend you not even listen to the rest of this podcast. And you're welcome to listen to it, and you're very welcome at this in this group, because I have a lot of addicts, ex-addicts, and that's, almost all addiction, the root of it is trauma. And the trauma is not the person's fault. And addiction is a disease. And I do believe that people can overcome those addictions. And that partly is a choice. I'm not going to argue whether addiction is a disease or a choice. And what I am going to say is that if you have suffered from addictions, you have my heart, you have my compassion. And I pray that God will help you with that. But I don't think the rest of the podcast is for you because... or you could go forward to where it starts with TMS. I'll put put timestamps here. TMS is the transcranial magnetic stimulation, but the next two are chemical substances. And I know that, for example, if I like to have a beer once in a while, and I don't think there's a problem with a Christian drinking alcohol. Again, it's a personal choice. But if you're in recovery, or maybe you're close to somebody who's in recovery, you probably don't drink, and that's a good thing. So if I have a friend who's in recovery, and I go to a restaurant, I'm not going to order a beer. That's not the right thing to do. You don't let your brother stumble. So I don't want to let anybody stumble. So don't listen to the rest of this. Fast forward to the next timestamp if you have addiction issues to chemical substances, okay? And for everybody else, I just want to say, do not do these on your own. The ketamine and the microdosing of psychedelics is not something you do on your own, period. I didn't include this, but CBD, you can do that and probably be okay, but I would still be cautious, and you need to talk to your doctor about potential interactions and side effects. Proceed with caution if you ever use CBD. It's a wonderful... And I don't know why I didn't include it in here, but I'm just going to throw that one out there as another possibility for treating and relieving PTSD symptoms. It's a wonderful possibility. And some people do smoke marijuana or consume marijuana under a doctor's care for the same reasons. And I'm just saying, do not do that unless you talk to a doctor first. CBD, just be cautious. Talk to a doctor first. Okay? Now with ketamine and microdosing of psychedelics, you're probably wondering, what the heck are those? So let's talk about them. I put those disclaimers out there. Again, I'm not telling you to use mind-altering substances. Even if you're not prone to addictions, if you're very sensitive to certain things, it may not be for you. Not every treatment is for every person. I just want you to see what some of the cutting-edge therapies are that are treating people and helping them to feel better and under very careful guidance from a doctor. So there's an article here. There's one article called Ketamine as a Rapid Treatment for PTSD, and it's by Dennis Charney, and he's at Mount Sinai, and it shows evidence for ketamine trials. So ketamine is basically, there's been trials that show that ketamine shows very quick and rapid relief of symptoms when somebody uses it with the right dose, being monitored by a doctor, following their doctor's advice to the letter, and adjusting very carefully. That it's been shown, there's some that where you do infusions, but it's been shown to dramatically reduce PTSD symptoms very quickly for some people. And there's another article here called Ketamine Infusions Reduce Symptom Severity in Individuals with Chronic Post-Traumatic Stress Disorder. So specifically CPTSD. And this is also a Mount Sinai article. And I wanted to read a little bit of this one to you. So there is one that is at the U.S. National Library of Medicine, and it's clinicaltrials.gov. So this is a government site, and it talks about studies that are coming out, medical studies. And this one is about the use of ketamine as a rapid treatment for post-traumatic stress disorder. And so I just wanted to read you the abstract, the description of the study, just so you get an idea. And if you want to look at the study yourself, I will link it in here. And there's tabs at the top. There's one that shows the details of the study. Another shows the numbers. If you could get into all the numbers, all of that. But I wanted to read that detailed description of this study to you. It's not that long. PTSD is a debilitating anxiety disorder characterized by intrusive re-experiences of traumatic events, avoidance of situation and stimuli that could serve as reminders of those events, and feeling jumpy or easily startled. We know that's more to it than that. Patients with PTSD are often depressed, and many have significant memory impairments. Existing drug treatments are unsuccessful in a majority of patients, especially with those with combat-related PTSD. Our aim is to test the effectiveness of a potential new drug for PTSD. Ketamine. For many years, intravenous ketamine has been extensively used for anesthesia. More recently, using doses lower than those for anesthesia, a single ketamine infusion, so it's a lower dose, was shown to rapidly reduce depressed mood as well as anxiety in patients with severe depression. Some clinical evidence of potential efficacy in depressed patients with comorbid PTSD also exists. Adverse effects in these studies have been limited to feeling intoxicated and having increased blood pressure during the infusion. In the present study, we expect a single ketamine infusion to reduce core PTSD symptoms. In other words, it's lasting. That's amazing. In addition, in those patients with PTSD who are depressed, we expect ketamine to reduce depressed mood. Finally, ketamine is shown to impair memory function temporarily. We will also test it if the extent of ketamine-induced memory impairment during the infusion can predict how well people do after the infusion. 40 patients with PTSD, with or without combat-related trauma histories, will be tested using a design that will compare the effectiveness of intravenous ketamine with that of another anesthetic drug, without any known long-term effects on anxiety, depression, mood, or memory function, that drug helping them. If ketamine is found to have the expected effects, future studies may explore additional benefits of repeated infusions and/or alternatives to intravenous drug administration. And so our study may contribute to improved function of patients with PTSD, providing a new means to rapidly treat the debilitating symptoms. And basically the outcome is that it's promising and that people are having a reduction of symptoms, and it's quick, and in many cases it's long lasting. And the rest of the study just goes into detail, and I won't bore you with all of that, but you can read the study and I'll link it below. But there's another article here that is more in layman's terms that you may want to read, and it's in Science Daily, and it's from the Mount Sinai Hospital as well. There's a lot of research coming out of Mount Sinai about this, and I'm trying to see if there's an author, but it is by Mount Sinai School of Medicine. And it says repeated ketamine infusions reduce PTSD symptom severity. And then the summary says the ketamine infusions significantly reduce symptom severity in individuals with chronic post-traumatic stress disorder, and the improvement is rapid and maintained for several weeks afterwards, according to a new study. And I think it's citing the study that or a very similar one that I just showed you before. But that's what it's showing. And it says, according to a study conducted by researchers at the School of Medicine at Mount Sinai, this study published in September in the American Journal of Psychiatry is the first randomized controlled trial of repeated ketamine administration for chronic PTSD, and suggests this may be a promising treatment for PTSD patients. And there's a whole article here. I'm not going to read it all because I don't want to bore you. I don't want it to get too bogged down. But basically, many experts have touted ketamine and psychedelics in micro doses under the care of a doctor who is not only a medical professional with a medical license to practice, but also has a special license to administer these particular drugs. They have to get extra treatment for that. It can't just be anybody. And then it says, but many have touted them as, quote, miracle drugs to treat PTSD. And there are promising results of many studies showing positive results of careful ketamine dosing with a licensed professional who has a special certificate to work with ketamine, as well as extensive medical knowledge and experience in general. So the results are extremely promising. And so you might do some of your own research on this, pray about it, use discernment. I would reach out to somebody who has a lot of expertise in this area and only do that under their guidance. So just be careful with that. And then the next one is microdosing using psychedelics. So we're getting even more controversial here. Don't shoot the messenger. I'm just telling you what these are. And keep in mind that these are microdoses of the drugs. You're not going out and taking a whole thing of LSD and tripping on it. We're talking about microdoses of psychedelics. I'm not telling you to go out in a cow field, and find some mushrooms That's not a good idea. Go talk to a professional, as always. I know this is tiresome to say, but I have to keep saying it with these especially. So there's a couple of articles here that I wanted to read to you, and one of them, or I'm not going to read the whole article, but a couple of articles that will back what I'm saying. And one is called Post-Traumatic Stress Disorder Treatment with Psychedelic Drugs by Bella Ratner. And it's NYU Grossman School of Medicine. And another one is Why Psychedelic Drugs May Become a Key Treatment for PTSD and Depression. And that one is by Emma Yasinski at the Smithsonian Institute. So the first one, I just wanted to read part of the article, the first article by Bella Ratner at NYU. And I wanted to read a section called Can Psilocybin Help Treat PTSD? Now, psilocybin is a mushroom, I believe, and it's one form of a psychedelic that medical professionals have done research on. They're still doing studies, and there's a lot of promising research on using these in small doses, tailored to the patient's physical and emotional needs under the care of a doctor, very closely monitored. So I just want to read you this article. This part of the article. And it just says, while therapy, antidepressants, and antipsychotics help many patients, these methods often fall short. Studies have suggested that antidepressants do not work well for people with multiple traumas over the course of years of chronic PTSD. A new study found that the antipsychotic risperidone worked no better than a placebo in alleviating PTSD symptoms. And then it says, because these drugs can also be intolerable with their side effects, many patients are left to experience PTSD with no sign of relief. And that's why many people turn to substance abuse. And that's why you have to be careful with this stuff. But they also can develop anger management issues, commit suicide, God forbid. A study analyzing the data from National Comorbidity Survey showed that 1 out of 6 anxiety diagnoses, PTSD, was significantly associated with suicide attempts. And it says there is some evidence in animal studies that show psilocybin, the psychedelic compound found in, quote, magic mushrooms, may act by stimulating nerve cell regrowth in part of the brain responsible for emotion and memory. A 2013 study from the University of South Florida found that psilocybin stimulates neurogenesis, the growth and repair of brain cells in the hippocampus. The hippocampus is that higher brain area, which the brain center for emotion and memory. In this study, mice that were given psilocybin, overcame fear conditioning far better than mice that were given a placebo. The study supported the hypothesis that psilocybin can help break the traumatic cycle that occurs in patients with PTSD. And then it just goes on to cite more studies that are more recent. Again, I'm not going to read all of it. There is a debate about this. There are questions if it's safe. It is controversial. There are risks involved. Some people can have, quote, a bad trip even with the microdosing. So that's why people need to start with the teeny tiniest doses and increase under the care of a doctor who knows what dosage you need and who can help you categorize it based on what you need. So read the article. You can learn more about it, but I just wanted you to see the potential for this treatment and that you need to be careful, but it could be also very revolutionary in treating PTSD. And then the next article, Why Psychedelic Drugs May Become a Key Treatment for PTSD and Depression, from the Smithsonian. That article talks a little bit more about just the whole overall overview of ketamine and, psychedelics, the overuse of ketamine and psychedelic research, and that it's just in its infancy, and there's so much more research that needs to be done before treatments will be widely available, and they're not for everybody with PTSD, but they are showing great promise, and in some cases, even miraculous promise. So I won't read you this article, but I will give you the link and you can look at it and get more details yourself. Let's go ahead and move forward to TMS, transcranial magnetic stimulation. Again, this one is not so much where addicts and People who have a tendency towards chemical addictions are vulnerable, but this one's just more like you need to be careful what you do to your body, obviously, right? So you don't want to just be doing this on your own, but there are doctor's offices. This is more widely available. Some insurances cover it, some insurances don't. But transcranial magnetic stimulation therapy is starting to become something that is used to treat treatment-resistant depression, and there's also indicative evidence that it helps with PTSD. And there's an article here called Transcranial Magnetic Stimulation Therapy, and you may be asking, what is that? And this is in Psychology Today, and it says transcranial magnetic stimulation, or TMS, is a non-invasive procedure that delivers magnetic pulses to the brain to change neural activity. It is used to treat mental health disorders, particularly depression, as well as neurological disorders. The procedure involves a magnetic coil that is placed over the scalp. Repetitive magnetic pulses emanate through the coil, enter the brain, and activate neurons in a targeted region, such as those that govern emotional regulation. See that? The increases and decreases of activity in those regions are what treat depression and other disorders. TMS is also referred to as repetitive transcranial magnetic stimulation, or lowercase r, uppercase TMS, RTMS. Okay? And which conditions is TMS used to treat, approved to treat? I want you to note that this treatment is now approved by the FDA. If you're in the U.S., that's the Federal Drug Administration, I think, or something like that, the Food and Drug Administration. And it's first approved TMS as a treatment for medical-resistant depression in 2008. Since then, its clinical applications have been expanded to cover major depressive disorder, certain migraine headaches, and OCD, obsessive compulsive disorder. So it's all stuff in the brain. And there's some evidence that TMS may treat anxiety and post-traumatic stress disorder. In terms of neurological disorders, TMS may help treat Parkinson's, multiple sclerosis, stroke, and Alzheimer's. I've also been looking into TMS to help me with nerve pain. So it can also help with a lot of neurological symptoms and disorders, and things like people that have pain from subluxations and slip discs in the spine and so forth and so on. What's the success rate of TMS? Well, to treat depression, around 30% of people with medication resistant achieve remission. That's pretty amazing from a full course of TMS, according to the National Institutes of Health. For context, around 60% of people with depression respond to typical treatments, so it gives them some relief. That's pretty amazing. And then there's another article here about transcranial magnetic stimulation treats depression, and it's by Dale Archer, MD. And it just shows you how it works. It gives you pictures and stuff. And so it's a really helpful article to show you how to do it. But one reason I wanted to share a specific article with you was because there are some new devices that have come out that have been approved by the FDA. And I'm not saying that you should use those, but I'm just saying that they're out there. And some of those are transcranial nerve stimulators, and other ones are VNS, vagal nerve stimulators. And I'll talk about that treatment as our last one in just a second. So transcranial magnetic stimulation is one thing to consider. And what conditions can it treat? It can treat certain physical and mental health conditions. It's shown promise with PTSD and with other conditions that are triggered by PTSD. It can help with major treatment-resistant depression. And so it does show a lot of promise with PTSD. Now, the last treatment that I wanted to talk about was VNS, or vagus nerve stimulation. And this one is probably one you've never heard of. Now, if you know my podcast and you know my YouTube channel, you know that I've probably talked about polyvagal theory. So if you want to know more about what that is, and I can't go into all that here because it's pretty involved, but I will put a link to two videos that I have in my YouTube channel. Subscribe to the YouTube channel. You'll get a lot of stuff there that you won't see here, where you can learn more about how to heal trauma. And but there's two there. One is about polyvagal theory, and the other one is about vagal nerve stimulation. And you might be like, what the heck is that? So those videos will help explain it a lot better than I can here with the time constraints that we have on the podcast. But I did want to, there's an article and it says, how does vagus nerve stimulation reduce PTSD symptoms? Now, the vagus nerve is the part that activates the parasympathetic branch of the autonomic nervous system. The parasympathetic branch is what causes regulation. That's what brings you back from fight or flight, back into regulation, back into that calm state. And so the vagus nerve is largely responsible for that. It also affects a lot of physical areas of your body, like swallowing and nerve movement in those parts of your body, like your throat. It affects digestion. It helps curb fight or flight, your stress response, having a calming effect on the mind. So hyperarousal that's on all the time, your vagal nerve can get overstimulated and even damaged. And so you can heal your vagus nerve that regulates all that stuff by using vagus nerve stimulation. Now, there are exercises you can do on your own. I talk about those in those videos. You can go check those out. But this is about vagus nerve stimulation. What I wanted to focus on were some devices that are showing promise. These have been cleared by the FDA. And I wanted to read a little bit about how these devices work. This one talks more about the devices instead of natural forms of vagus nerve stimulation. You can use both. Again, proceed with caution. Talk to a doctor. Don't just be experimenting on yourself without some kind of caution. This isn't for everybody. If you have medical conditions that involve like Parkinson's or seizures and stuff in the brain, do not use these until you talk to a doctor, especially, please, okay? But just be careful. But there are 2 FDA-approved breakthrough stimulator machines, and the Berglund article talks about that. It says that stimulating the vagus nerve activates the parasympathetic branch of the autonomic nervous system in ways that curb fight or flight, stress responses, which has a calming effect on the body and mind. So these stimulating machines will do that for you in these cases. By counteracting hyperarousal, the sympathetic nervous system stress response, vagus nerve stimulation also reduces post-traumatic stress disorder symptoms by curtailing inflammatory responses. A recent study pilot of non-invasive transcutaneous cervical vagal nerve stimulation device found that 3 months of TCVNS treatment resulted in a 31% greater reduction in PTSD symptoms compared to sham treatment, or a placebo, which is a sugar pill. It's nothing, right? They just tell you you're getting the treatment, but you don't. And then these preliminary results suggest that TCVNS reduces inflammatory responses to stress, which may in part underlie beneficial effects on PTSD symptoms, the authors explain. Omer Enon in Georgia at the Georgia Institute of Technology, Georgia Tech, go Jackets. But the School of Electrical and Computer Engineering and Coulter Department of Biomedical Engineering was the study's senior author. So these are people that are, experts in this field, and they know about how to connect the engineering side of this to the brain and to neurobiology. And so but there's been all kinds of studies done on this, and there's 2 specific devices that I'll tell you about in just a second. And that's a very significant study. That's pretty significant. If you can reduce your PTSD symptoms by 30%, you'd probably do it. Like I said, look at the 2 videos that I have below about polyvagal and vagus nerve stimulation, and that'll help you. Check out those in the show notes. And then another preliminary study, it says, another preliminary study of non-invasive VNS that targets the auricular branch of the vagus nerve via the outer ear found that these devices increase parasympathetic activity, that's regulation, and decrease sympathetic nervous system activity, that's dysregulation and fight or flight, which has positive effects on hyperarousal and the autonomic state of patients with PTSD. And then these effects suggest that TVNS may modulate emotional state as reflected by down-regulating fight or flight and up-regulating a physiological state conducive to positive social engagement, which is part of regulation, co-regulation. The first author, Damon Lamb of the University of Florida, co-author writes. Okay, so that shows you that there's study after study that backs up the use of this device. And so there are 2 devices that have been approved by the FDA. One of them is called the Phoenix, and it's pretty expensive. I've looked at it. It delivers a mild electrical tingle that stimulates the vagus nerve via the patient's outer ear. And it has gotten breakthrough device designation from the FDA to treat post-traumatic stress disorder. And there's another one that is called the Gamma Core, and it also received FDA breakthrough device designation to treat PTSD, and it's a handheld RVNS device stimulating the vagus nerve, which pulses of electricity delivered through the skin or the side of the patient's neck. Be careful with these devices, please. And I'm going to tell you this, but I'm going to tell you to be very, very careful. If you go to Amazon, and I'm not telling you to go buy one of these devices and turn it on high and go use it. Be careful. But there are devices that do TCVNS, RVNS, and there's one other VNS, I forgot, TVNS. And they're different types of signals. You need to do your research, but there are devices that will do these pulses that are not these 2 devices. You can get them on Amazon. Okay, so just go look at the bottom of this article, the Psychology Today article about vagus nerve stimulation by Christopher Berglund. I'll put the link in the show notes. And then if you go to the bottom, it'll show you those 2 devices. And it also tells you the different types of pulses, TVNS, TCVNS, and RVNS. Do some research on what each one does. And then you can actually find other devices online that are cheaper than these. But again, look for high ratings. Be careful. And just be careful, okay? I'm not saying you should go out and do that. I'm just giving you that as an alternative. And I can't, like I said, use the advice of a medical professional and be really careful, okay? So those are 9 practices that you can use with the help of a licensed professional. If you get the VNS, vagus nerve stimulation, you can also get that with the help and guidance of some of the experts with the Phoenix and the Gamma Core. I think they have experts that can guide you. So that's the safer way to go, but it's also the more expensive way. I understand money does not grow on trees, okay? Most of these therapies cost money. And there are some things you can do that are safe and effective that you can do yourself. You can do EFT for instead of acupuncture. It's not as effective. You can do self-massage. You can get somebody else to give you a massage. You can do co-regulation with other people and with your pets. And so there are cheap and safe ways to do some of this on your own. Vagus nerve stimulation, Google it, YouTube it. There's a lot of great exercises out there. And check out the videos. I include more resources on that there too as well. Things you can do on your own that are cheaper and safer. So I've included these because I want you to be aware of them because I want people to get relief. But just be cautious. And especially with the chemical ones and with the ones that send currents through your body. And if you have certain medical conditions that track with those being dangerous, do not use those treatments at all, okay? And proceed with caution if you don't with a medical professional, okay? So this was episode 16 of season 2 of Christian Emotional Recovery. This episode covered the second part of a series that was Somatic Practices for Healing Trauma. The first episode talked about somatic practices that you can do on your own, and this one talked about somatic practices you want to do with a professional only. And so that's that for this. Thank you so much for listening. Like I said, check out the YouTube channel. Check out my new store. The link is below. There's just one thing in it right now, but it's gonna grow. Get in while it's early and things are cheap because the prices will go up. I'm trying to raise money for the podcast and to live on. So I'm just gonna be honest. You're supporting me and you're supporting other trauma survivors when you put money into that store as well as the podcast. Thank you so much for your time. God bless you. Have a great day, and remember, you are fearfully and wonderfully made, and God loves you.
Thank you so much for tuning in to this week's episode of Christian Emotional Recovery, hosted by Rachel Leroy. For links to this week's resources and to join the discussion, check out this episode's show notes at christianemotionalrecovery.com, where you can also find links to our YouTube channel and Facebook group. Join our email list and get other episodes and resources. If you enjoyed the podcast, please rate and review the podcast and tell a friend who may benefit from this message. See you next time. And remember, beloveds, God loves you, and you are fearfully and wonderfully made.